and happening in just 1 hour. A Norfolk critical care doctor is taking Sentara Healthcare to court over a ban on certain medications for COVID-19 treatment, including the use of ivermectin.
Ivermectin is a drug used to treat parasites in horses and livestock with limited approved uses in humans. The FDA and CDC do not approve the use of ivermectin for patients with COVID-19. Evan Watson is live now at the Norfolk Courthouse. So, Evan, what can you tell us?
About 100 protesters are here outside the Norfolk Courthouse to support Dr. Paul Marik, a Norfolk doctor who's suing Sentara over the right to use ivermectin and other medications for COVID-19 treatment. Sentara Healthcare has a list of medications it does not endorse for COVID-19, citing the federal organizations that don't approve them, safety and efficacy concerns. I want to show you the people who are gathered here right now. Dr. Marik just walked into the courtroom. I just talked to him not more than 10 minutes ago. He was greeted with applause and cheers and even sung by this group of supporters who's out here today ahead of an injunction hearing at 1. Marik is an EVMS physician under contract at Sentara Norfolk General Hospital. He says critically ill patients with COVID-19 are dying, quote, unnecessarily and unjustifiably. In the lawsuit, he argues that Sentara's guidelines are preventing patients from exercising their right to choose what medications they receive in consultation with their doctor. Sentara says in most situations, physicians are able to deviate from guidelines to individualize care for patients, but in some scenarios, treatments may potentially harm patients or that are widely considered to be outside the standard of care may be limited, and that was a quote. Dr. Marik helped create a treatment protocol called MAT Plus that includes the use of ivermectin and other drugs. In the lawsuit, he alleges that protocol is more effective at preventing COVID-19 deaths than FDA-approved methods. The injunction hearing in Norfolk Circuit Court will be at 1. A judge will hear arguments about the safety of ivermectin and other drugs, and that key point about what role did the doctor play and what role does hospital administration play in determining what drugs and medications are appropriate for patient use, or at least appropriate for patient options. This is a very charged and enthusiastic crowd that's here outside of the courthouse right now. I mentioned the song they were singing, God Bless America. Dr. Marik was almost brought to tears as he walked up, many asking him for help, many asking what they should do with their loved ones, many saying they've been following along with his nonprofit, his protocols, his research, and believe that his methods are the right way to treat COVID-19. We'll see what comes out of that hearing, and I'll have a lot more updates, including sound from Dr. Marik today at 4, 5, and 6 on 13 News Now. Reporting live in Norfolk, I'm Evan Watson for 13 News Now.
Okay, Evan, a lot to watch with this. So he will be following this case as it plays out today, as he just mentioned. Be sure to catch up on updates on air, online, and on 13 News Now throughout the day.